Good morning. On the occasion of World Hepatitis Day, I, Dr. Jaya Chaterjee, working as a consultant gastroenterologist at PLS Hospital, Kolkata, I would like to share a few words regarding chronic hepatitis B and C with you. If you see, like every year, World Health Organization has set a theme for this year also. This is hepatitis-free future. So why we are using these terms and what is the meaning of it? So I like to share a few practical points for this. Worldwide, if you see the overall about 300 million people, they are affected with chronic hepatitis B, and about 70 million people, they are affected with chronic hepatitis C. And only 10% of hepatitis B and about 15% of chronic hepatitis C, they are aware that they are infected with those viruses. And only about 15 to 16% of them, they have access to the treatment. Every day, we lose thousands of people from chronic hepatitis B and C related liver damage and their complications, even in this COVID pandemic area. In 2015 and 16, the data shows that about 9 lakh people we have lost from chronic hepatitis B. So it's a huge number which is affecting worldwide a different age group, but the very little portion of the people, they are aware of their infection and they have the access for the treatment. So that is the point of discussion. So what is chronic hepatitis B and what is chronic C? There are 5 viruses which affects liver. But we are more concerned with the hepatitis B and C because they can cause chronic damage to the liver, causing inflammation, that is hepatitis, to fibrosis and to cirrhosis, and ultimately some of them develop cancer, or from cirrhosis they develop portal hypertension related complications with abdominal fluid accumulation, ascites, variceal bleed, encephalopathy, and ultimately death, or they go for liver transplant. And that puts a lots of health quality of life in question, as well as puts lots of financial burden. So if we work on that, to diagnose these patients early and to treat them with those require treatment, then this burden can be reduced. So the mode of transmission, how these transmissions occurs in hepatitis B and C. The most important transmission in chronic Hep B is the maternal to child transmission, that is parenteral transmission from pregnant mother to the children. So if we cut down the transmission from pregnant mother to the children by diagnosing the pregnant mother, and if they need treatment, treat them with the antivirals or the medicines for hepatitis B, which are quite safe in pregnancy. So we can cut down the transmission from pregnant to newborn. And vaccination is another point. So every live birth vaccine we should give to the newborn, particularly those are pregnant, and even as a immunization schedule program. If you see, only 42% worldwide, they are covered by vaccines. So there is a huge gap between this vaccination program and application. So we need to be aware of the things that very little number of people who know that they have disease. So we have to screen a lot of patients, and screen particularly those are high risk, that is the healthcare worker, those are requiring blood transfusion repeatedly, from pregnant patients to IV drug users and sex workers and like that. So we work all together on this so that we can fight together chronic hepatitis B and C, and we can eliminate this disease and disease-related complication by 2030 and to have a hepatitis-free future. So for this, the most important thing is to find the missing million. That is, we have to select and you have to identify those are affected by these viruses. Thank you.